are watching The Convo with Dr. Fridah and James Wetu. Convo, encouraging conversation that matter.
This is the Doctor's Bench. We are having a conversation about mental health and mental illnesses, and we have had two panelists share with us, and we are learning a lot, and I want to thank you for staying with us. I can still see people and comments trickling in, and we are ready for your questions, so do not be afraid to ask your question. If you're afraid to ask it, you can ask for your neighbor. You can say, I'm asking for my neighbor. Or you could do an inbox message to us in our pages and profiles. We are ready to respond to all of them. So just to thank the panelists that have helped us advance this conversation, Pastor Ben and Elizabeth, that was a wonderful discussion. We are very informed right now, and we are ready to take this a notch higher. Joined in by another panelist. He's a psychiatric nurse, and he's a CEO of Community Mental Health Foundation, and he's ready to share with us briefly about some of the common myths and misconceptions and other mental health disorders that we have not dealt with before. So I want to welcome him to the studio. Karibu sana, Mr. Kariuki.
Asante sana. Sorry.
It's okay, you can speak.
Asante sana.
Yes.
My name is John Kariuki.
Yeah.
Psychiatric nurse by profession.
Mm-hmm.
A passionate mental health personnel.
Yes.
A founder of a Community Mental Health Foundation.
Uh-huh.
Currently disseminating health information,
Mm-hmm.
mental health information.
Mm-hmm.
I want to first start by saying that mental health
Mm-hmm.
is really on one of the rising issues of health,
Mm-hmm.
especially in our country,
Mm-hmm.
based on COVID, based on issues, based on things that have been happening.
Yeah.
And mental health, I want to say that there is no health without mental health.
Absolutely.
Because a mental, let me explain, let me define this,
Mm-hmm.
that a mental illness,
Mm-hmm.
mental health
Mm-hmm.
is essentially being well-being of the mind,
Yes.
a state of well-being
Yes.
that is mental, spiritual, and the composition
Mm-hmm.
really entails your mind should be well.
Mm-hmm.
And this doesn't mean that it is not in the absence of problems, in the absence of stress, in the absence of diseases and
Mm-hmm.
issues.
Mm-hmm.
That means you have the issues,
Mm-hmm.
but you're coping.
You're coping.
That is what is mental health.
Wow.
So on the other, I want to separate mental health and a mental illness.
Please
So people will understand.
Yeah.
A mental illness is a disease
Mm-hmm.
that affects your mind,
Mm-hmm.
the functioning of your mind.
Mm-hmm.
And I repeat, it is a disease
Mm-hmm.
that affects the functioning
Of your
your
mind.
mind.
Uh-huh.
That is your thinking,
Yes.
your mood,
Yes.
your affect,
Yes.
and your behavior.
Uh-huh.
So a person who is mentally ill
Mm.
will not be mentally healthy.
Okay.
Are we together?
Okay.
So this, so when you are mentally ill,
Mm-hmm.
I want to go and because of time.
Mm-hmm.
When you're mentally ill, there is a way someone presents,
Mm-hmm.
and that is why I feel this is quite a good initiative,
Mm-hmm.
because we have so many people
Mm-hmm.
who are out there
Mm-hmm.
and are suffering
Mm-hmm.
and don't know where to go.
Mm-hmm.
They don't know where to seek help,
Mm-hmm.
what to do. Some are just praying and saying, okay, nimerushiwa mashetani. I have someone threw demons to me.
Yeah.
It's witchcraft.
Yeah, you're bewitched.
So the myths and misconceptions around mental health
Mm-hmm.
are many.
Yes.
Mental illnesses are many.
Yes, yes.
So someone will get sick, and in a family you notice this person is like diverting from normal.
Mm-hmm.
He's keeping quiet, aloof, not talking.
Mm-hmm.
Actually, he's not even able to eat.
Yes.
And so instead of, because you lack the information that if someone is mentally sick will present this way, you won't go seeking help, maybe to a psychologist,
Mm-hmm.
maybe to a psychiatric nurse,
Mm-hmm.
maybe to a psychiatric doctor,
Mm-hmm.
because you don't have information.
Mm-hmm.
And that is why I believe that us being here today
Mhm.
will help many.
Mm-hmm.
A person who is mentally sick, who has a mental illness,
Mm-hmm.
we usually check on several aspects. I start with general appearance.
Yes.
Someone who was neat, head hygiene.
Yes.
Used to wake up, go take a shower. Someone who used to like take we usually call them the activities of daily living, initiatives, is able to it. You notice this person is becoming unkempt. Someone used to see in suits is wearing shorts that are cut from trousers.
Yeah, and
someone who
finished.
used to be neat, you realize that he's not even taking showers, he's thinking.
Yeah.
Someone who used to let me put it, the general appearance, the way you appear, the deviation from normal should tell someone this person is heading is getting a mental illness and should be able to like start seeking or intervening. The next thing we check on is the speech, the way you talk, because if you used to be someone who's calm in your speeches and all of a sudden you realize that someone is using vulgar language, someone is changing from he was someone who was using low tones while he's speaking, someone who was understanding, and he's changing, it's becoming aggressive once you do something small, raising the voices. So that is someone who is ending up into a mental illness. I go to mood. In mood, this is basically on personality. Someone who's diverting from the real normal, you might be an introvert. You don't want to talk to people. You like someone who's like keeping yourself indoors. You don't like more like going out on outs. Then all of a sudden, you start noticing a person who's not talkative is becoming talkative. All of a sudden, a person who was not outgoing is somehow developing some kind of is becoming an outgoing.
I think that's interesting because most of us assume that how to tell someone is having a mental illness is when they were extroverted or outgoing and now they are introverts. You know, that's what we always assume. So the opposite is also...
Yeah, when someone is diverting from the initial personality to another personality, you should note there is a change. So someone who was a talkative person changes all of a sudden, becomes someone who is silent, aloof. Sometimes at some point they become mute. They don't talk at all. You try to talking to someone, he's not talking. He's like, we used to go out. Why don't we go on this weekend? And he tells you, no, I want to stay indoors. You should notice there is a change in that person. The other thing we check on to know whether someone is becoming mentally ill is something called disturbances of thought process. So for us, when you come into hospital and we are doing a mental status assessment, we'll check on the thought process. Thought process is how you are thinking. This entails, like, when you are thinking, do you have like exaggerations, things we call word salad? Do you have flight of ideas? You'll notice we're having a discussion right now. Then I deviate all of a sudden and start talking about farming. That is abnormal. So thought process.
The flow of thoughts is
interrupted. The flow of thoughts. Someone will use languages, we use words that have no meanings. We call that neologism. So you notice this kind of abnormality in the way the speech, the flow of speech, flight of ideas. You're talking to someone, shifts from the topic you're having to another one, to another one. This is someone who's getting sick. To go on, we usually also check on thought content, different from thought process. What is the content of your thoughts? Some people tend to develop something called delusions. Delusions are false beliefs that cannot be changed by any logical thinking. Someone will tend to say, I'm the richest person in Kenya. I'm Uhuru. So you see? The kind of the content of the thoughts. I mean, someone will wake up and tell you, I'm feeling that it's as if I don't have my hand. I'm feeling as if I don't have my stomach. My stomach is not there. Those are called, they are somatic delusions, dualistic delusions. You notice someone who's getting to mental illness is becoming paranoid, has paranoid delusions, is believing that you are out to harm him. Like a mother, when you have a kid, maybe a teenage, and he's someone you used to relate with well, and all of a sudden, this kid, this teenage starts feeling that you as the mother or the father is hating, is actually, you mean ill for this teenage. That means there is deviation from normal, because in a normal scenario, a mother and a child should relate well.
Yes.
A normal scenario, when you meet with someone, should relate well. But what is this that should make me feel that you are making you are out to harm me? Hope the other thing is like persecutory delusions, where someone, you find you cooked food, and someone is, I won't eat that food because I believe it's poisoned. So that is someone who's mentally sick, far away from you know, the difference, the problem with our community, and where I can see there's a gap is when you get when you get hypertension, you're able to know because you have headache. Okay?
Yes.
When you have diabetes, you're able to know because you start sweating.
Yes.
You'll feel weak.
Yes.
You'll know I'm not well.
Yes.
But for a person who's getting mental illness, who lack insight. When I don't have insight, I will not know I'm sick.
So the mentally ill patients don't know that they are sick.
Yeah, they don't know. So I will require Dr. Elizabeth to identify that I need help. Are you together? So that is the major difference, actually, because someone who has a physical illness, diabetes, name them, hypertension, pneumonia, all those kind of physical illnesses, will have insight, will know I'm not feeling well. Once you are getting into mental illness, you are actually diverting from normal. You don't know, you lack insight. You don't know yourself. The awareness of your surrounding is kind of vanishing. So the other thing we usually check on is when you realize someone is losing the memory, the cognition part of the brain. You realize someone is losing the memory in this way. You may have eaten supper or maybe breakfast, and then all of a sudden someone asks, what have you had for breakfast? And you'll notice, because I'm having issues in my mind, I'm not able to remember what we took. So the present, past, and remote memory is impaired.
Okay.
The other thing we usually check on is the orientation. You will meet with someone who used to be jovial and was quite brighter. Ask him, when is today or the last whatever we had? He will seem to be disorientated on time, place, to a point he's unable to tell, this is my mother.
Okay.
So that is someone who's getting mental illness. The hallmark of it is losing your insight.
Okay.
So those are basically some of the things you should check into whether someone is getting a mental illness.
Yeah. So just to cut you short, so I was watching a documentary called The Madness of Bedlam. True. And how they were treating patients. Bedlam is Bethlehem. How they were treating the mentally ill patients then, and they would lock them in a place and deny them food, and at some point they would want to beat the madness out of that person. So as a result, the person got worse and worse and worse until they died in that condition. And then I thought about it. You know, that was ages and ages ago. But I thought about it, and I even remembered a scenario where I come from, there was a person who, you know, those people who start collecting papers, then they start chasing around people and beating people by the roadside. And by then I was not into medical school, so I didn't know this is a mental illness. But what surprised me is how that case was handled, because that person was taken, alijengewa room, and they were locked into that room until the day they died. So they were like in isolation in that room. They would only get the medications. So the parents would go get the medications for the patient, bring the medications for that person, and they would feed them. They would not even have human contact with the person. And I thought to myself, isn't that the same thing as what was being done ages ago? So that these caregivers don't know what else to do with these people. So I want you to talk to a caregiver of, you know, we are saying mental illness is becoming very, very common. And people think this person is dangerous. You're just talking to us about myths and misconceptions of mental illness and mental health. People think this person is dangerous. They're out here to harm me, which sometimes it's true, because they don't even have insight. The things they are doing, they don't know they are doing them. But I want you to talk to caregivers. Instead of locking that person in and isolating them, because I know that mental illness thrives in isolation. So what should they do?
When you realize someone, let me go back to ages.
Okay.
The history of mental illness and mental health in Kenya, whereby at around the year 1910, the so-called Mathare Hospital was a smallpox center.
Okay, I didn't know that.
So go read that history.
That's
it was a smallpox center.
Okay.
And once, as years advanced, they realized that people who usually get, some people are getting abnormal. Let me make it briefer.
Okay.
So the treatment in Mathare, the people who are being employed there were people who are huge, energetic, and people who could beat up the patients.
Oh.
That is what they used to do. So later, as years advance, so when you go back to the history, even globally, patients who could get mental illnesses were used to be beaten, rolled down the river, put in whatever, rolled down the river, hanged. Such were the kind of how people used to treat, because they believed this person has demons.
Oh, yeah.
This person is bewitched. So due to those myths and misconceptions, that is how people were used to be treated. But for someone who's mentally ill, this is science now. Later, after years, we realized that when you are mentally, the whole human being, however huge you are, you are controlled by a number of neurotransmitters, 6 or 7. 6 chemicals will control everything, every part of your body, every activity you take.
Sure.
So when these neurotransmitters, if we talk of a neurotransmitter called serotonin, in your mind, if serotonin goes up, you'll be jovial.
You'll be manic.
You'll be manic. If serotonin goes down, you get depression. So when you are mentally sick and you come for treatment, we usually focus on how are you presenting. Then how are you presenting is basically the cause of the neurotransmitters that have been interfered with in your mind. So when we focus on that and notice the abnormality, we treat the abnormality by giving drugs that will stabilize these neurotransmitters. When depression is there, you have your serotonin is down. We give you antidepressants to raise your serotonin, and you go back to normal. So we do treatment. That is, we do pharmacology. Pharmacological whatever. We also do. We also recommend psychotherapy. Because this someone maybe it's mental illness is not only out of. I wish to talk about several causes. Whereby we'll start with genes. In a family, there can be a faulty gene that is a gene for schizophrenia, a gene for depression, a gene for mania. And then when you are born, you're already predisposed to a certain mental illness. So out of the psychosocial, your environment, what surrounds you, because of COVID, you dismissed from work, and that gave you stress. Initially, you are predisposed to schizophrenia. So you get schizophrenia because you got stress. So you can live with a gene for a mental illness, but it's not like dominant. It's not something that's coming out.
Okay, that's interesting. So that means if somebody has a genetic predisposition to maybe say schizophrenia, it doesn't mean that they must get schizophrenia.
It's not a must. It's not a must.
I think that's why I love preventive medicine, because such a person, you can tell them what to do in order not to get into that condition, right?
Yeah. The next cause of a mental illness is what we call psychosocial factors. What surrounds you? Stresses at work, loss of a loved one, those traumatic experiences in life. And that's why it's important when you feel your mood is going down out of something that happened. Don't wait until you are at a point where you feel like life, I don't have any interest. There's something called a hedonia. You don't have pleasure in this life.
Yeah.
You feel you don't want anything in this
You
life,
don't-
and
yeah.
at the end of it, get depression.
Yeah.
So seek for help.
Yeah.
The other cause that is a major concern to our country is about drugs. So someone goes out, takes alcohol, says, nakunywa, I'm taking, let me not put it because we are whatever, I'm taking to feel good. Yeah, it's maybe you feel good, but what is after feeling good? What happens after that? So alcohol interferes with some neurotransmitters. So at the end of the day, you get alcoholic psychosis,
Oh dear.
hallucinosis, and what have you. You go to
Yes.
Madare because you are mentally sick. Someone smokes bangi, marijuana.
Yes.
If you smoke bangi, it interferes with dopamine
Yeah.
and serotonin.
Yes.
So when you smoke bangi, you getting the pleasure out of bangi, feeling in your own world. So you like you feel good, the way they say. But what is the outcome of smoking bangi? You get a mental illness. You become psychotic. You start collecting papers, bizarre behavior. Something called bizarre behavior is abnormal behavior. Someone collects lots of papers, liters out here.
Yes.
Someone is out there and is like walking naked, lacks inside, doesn't know he's naked because he smoked bangi, interfered with the neurotransmitters, got sick. Another cause of a mental illness, maybe the I could put it as the last one, is but this is more of predisposition.
Okay.
Is about when someone has the personality. Some personality more predispose someone to getting a mental illness.
Okay.
So when you are schizoid or paranoid, this is someone who is not sick, but basically is paranoid. Believes Dr. Elizabeth can harm me. So there's some people who tend, even in social places, you find someone like sitting at the door.
Okay. Because they are paranoid.
If he believes the congregants here,
Yes.
one of them might harm me. Because this person is paranoid.
Okay.
There are some people you hear them telling you, I don't like eating in other people's place. They believe they can be poisoned. So that personality more predisposes this person to getting a mental illness.
Okay.
So once you understand your personality, sit down, analyze, how am I? Am I schizoid? Am I an introvert? Am I an extrovert?
Yeah.
So when you analyze yourself, you get an internal know-how on how you are. Then you're able to you're able to cope, and you're able to prevent. Once you are going to abnormal, you can be able to know.
Okay. So my next question would be, I know I am in medical school, and I know not many of my classmates want to venture into psychiatry.
Sure.
So I am just wondering, how is the ratio of mental health care workers to the patients? Do we have enough of them?
Basically, and this is what is there, is any person you meet outside has an issue. Me and you, you have at the back of your mind, you have something that is stressing you.
Yes.
So the degree, as it's the layman's put it,
Yeah.
of a mental illness
Yeah.
just differs.
Yeah.
So you are not up to being mentally sick
Yeah.
to going to Madare,
Yeah.
but you have an issue.
Yeah.
And let me go back a bit in answering your question this way, that the reason as to why we have like so many people who are mentally sick and even are not seeking health care, when you compare that to the professional psychiatric doctors, psychologists, psychiatric nurses, is because the fears around the field. Because you believe when you're passing around Madare Hospital, that Madare Hospital is there are demons in there. The people who are in there, someone who have a perspective that when I get into Madare Hospital, I'll meet with people who will beat up me. So the fear of what happens in it
Yes.
is actually what makes people not to train on mental health. So
Yeah.
if they could know that this person is just a matter of neurotransmitters, we should reverse. Someone will get interested into venturing and going and doing mental health. So that is the fear around that is what should be arrayed, and we should like the Ministry of Health should like destigmatize. One of the objectives around mental health is to destigmatize the mental mental health,
Yeah.
whatever,
Yeah.
the department there.
Yeah.
Because people tend to believe that a mentally sick person is someone who is out there to harm you. Contrary to what is reality, this is a mentally sick person is someone who needs compassion, good care from the family members, the church, and everyone around you. This is someone who's looking for compassion rather than being stigmatized
And isolated.
So when you isolate and stigmatize this person, you're actually doing more harm to the patient.
Okay. I think I was one of those people you were speaking about, those people that are afraid of mentally ill patients. I would go to Mathare and stay on my toes, ready to run. But now I know better. Because of time, my director is giving me the eyes again. Because of time, I want you to speak to us about suicide so that we end the session. Speak to us about suicide.
Suicide, I will start by saying it's one of the day in, day out in nations, in newspapers, we're getting people say, we're getting reports of people committing suicide.
Yes.
And homicide. People talk of suicide and avoid homicide.
Yeah.
Suicide is when you take your life. You end your life.
Yes.
Homicide is when you end someone's life.
Okay.
Those are two different things.
Yeah.
That people tend to dwell much on suicide, which is actually on the rise, and forget about homicide.
Yeah.
Suicide is an action of ending your life, maybe by hanging yourself somewhere, throwing yourself on a road, on a river, and it's actually most of the time secondary to depression.
Okay.
So someone who has depression, who started feeling an overwhelming feeling of sadness, aloofness, you don't want to talk, you feeling overwhelmed by life, that is depression. Then it is what now brings up or prompts suicide.
Okay.
Because when before you tend to get to suicide,
yes,
you must have issues.
Yes.
Because everyone would wish to live.
Yes.
Live well. Live like a wealthy life. It's kind of the best life you would wish. But because issues came in life, and you found yourself in issues, and you feel you don't have solutions.
You have more than
yeah, you feel that what I have right now,
yeah,
I cannot get a solution.
Okay.
Whether I go to a pastor, whether I go to all the other places people believe there are solutions, you feel the best option is to end life.
Yes.
So the most important approach or the society should have about suicide is when you identify someone is like going down, depressed, aloofness, not talking, try to talk to this person. Don't say like he has his own issues.
Yeah.
2, when someone is about to commit suicide, it's important for the public to know this.
Yes.
All our viewers.
Yes.
Every person who commits suicide, there's something we call actual, potential suicide, and actual.
Okay.
Potential is someone who is there
Yes.
and can commit suicide later. This is someone who keep on church, and when you're talking on your friend, they tell you, I usually feel like I can kill myself. I feel like I can take a red rat. Don't ignore that.
Yes.
It's a red flag.
Yeah.
So an actual, whatever is suicide, is someone who can commit suicide in the next minute. Is someone who has a rope.
Okay.
Someone who has bought something kept somewhere to commit suicide. So I would urge our viewers, or the public in general, when someone communicates, writes a letter, I'm going to commit suicide, don't ignore that.
Okay.
When someone tells you, I'm feeling overwhelmed, I can end this life, don't ignore that. Don't actually mock this person by telling him, can you do it, we see? Because that is the public usually, most of the people will do that.
I've heard
will tell you, you kill yourself, it's your life.
At
the end of the day, you realize that person actually did it.
Yes.
So this suicide is something, suicide and homicide, something that can be prevented.
Okay.
How? I feel I'm overwhelmed at workplace. My boss is giving me stress. Maybe things are not working. What do? seek a psychologist.
Okay.
A psychologist will be able to tell you the level you are in, you're supposed to be treated. What is the next option? Medications. So don't wait until at the point where you are aged.
Yeah.
So seek for help.
Okay.
And that will prevent most from committing suicide. For us in Community Mental Health Foundation, we've developed a platform whereby we are seeking to liaise with counties in this way, that we will have a toll-free number. That because most of the people, I would feel I don't want to tell Eliza I want to commit suicide because she might go talking out there. How does she take me? But I might be comfortable to talk to a stranger about feeling that I want to commit suicide. So for us, although it's in the process, we're developing a toll-free number whereby we'll liaise with counties. If you feel you want to commit suicide, you can click a certain code, it calls in our center, and then we're able to rescue and help you.
Have you encountered suicide before yourself? Have you had an experience like that before?
Personally, I'm a victim of suicide. And that is what prompted me to like more of loving mental health, wishing if I could do psychiatric, I could do mental health as a course, or to go to train in school. One happened when I was a teenager. I had issues. Basically, that is what is expected. I had issues, and that pushed me, and I could feel aged. So one day I happened to go to a shop of a kind, bought a red rat, and I wanted to. I really was feeling the only option I had was to take that tablet. Fortunately, and that is why I'm saying that the first care that should be given on suicide clients from the family, because the people who are around me noticed someone is not normal today, someone who speaks is not normal. So when I entered into my room, my family members, one of them followed me and asked me, what is wrong with you? And then realized that I had a tablet. And when I took actually water, when you see someone is stressed, goes out, takes a glass of water, gets into his room and closes, what do you think this person is why couldn't he have taken the tablet outside, the water outside? Why is he closing the door to take water? Yet he's not crying. So when I was about there, so they confiscated the tablet from me. And I want to say you can't separate health with spiritual. So some few members of our church came and prayed to me, and later, if you delay someone who's about to commit suicide for 5 minutes time, he won't commit suicide.
Oh, wow.
That's a fact. So I moved from there, and I'm actually, I usually feel it good to talk about it because I know it helps many. So when you feel aged, look for help. That's when they delayed me and confiscated the red rat, the whatever, I was able to, like, on the future, on the following days, I was able to talk. So I talked, and I felt my problems were like sorted. And contrary to what I believed initially, that I couldn't get solutions to my problems.
I think it's important to share stories because people might think that we are just talking about mental health and we have not experienced some of these things. And it's very encouraging to see you very passionate about mental health because not very many people are, because not very many people understand what mental health is and what mental illnesses are. So I know time is gone and we'll have a conversation later on. We'll have to plan another one because we have not talked about so many things. I know there are so many illnesses that we would have mentioned, like postpartum depression, schizophrenia, bipolar disorders, delusional disorders, anxiety disorders, all those things. But because we don't have time, I want to end this session here. But I want you to give a parting shot. Maybe speak to mental health care providers, the advocates, the activists, counseling psychologists, the psychiatric nurses. What would be your message to them at this point?
I want to my message to our beloved Dr. Jogona. Dr. Jogona is the Director of Mental Health Services in Kenya. And the Ministry of Health and other mental health providers is that we need to do more of prevention than cure.
Exactly.
So let us not wait in our private facilities,
Yes.
in the government facilities,
Yes.
that until a teenage takes bangi and becomes mentally sick, that we wait for this person to treat. Let us go to the community, disseminate health information.
Okay.
So this information is power.
Yes.
So when we disseminate this health information,
Yes.
this person will be able to know, like, if I take this will affect me. And maybe you could allow me to end up by this.
Yes.
I know in the interest of time,
Yes.
there's something we usually call basis.
Yes. Yes.
I would have forgotten that, and it's quite important.
Yeah, it's very
So
important.
how do you become, you usually say, if you want to be physically healthy, you eat this, you eat this. For you to be mentally healthy, this is what you do from today.
Yes.
Take this as a mnemonic.
Yes.
Basis.
Basis.
BACES.
Yes.
So for the B, we usually say the body.
Yes.
Take good care of your body.
Yes.
Eat, rest, exercise. Do anything that benefits your body.
Yes.
And know what can harm your body. So like alcohol will harm your body,
Yes.
bangi will harm your body,
Yes.
and any other drug will harm your body. So for A, we usually say achieve. So in achieving, if you plan a small task and achieve, there is a sense of confidence, a sense of well-being
Yes.
mentally.
Yes.
So actually, if you don't have confidence, so
Yes.
start planning small activities that you achieve,
Yes.
and that will raise your confidence.
Yes.
So for the C, we usually say connect. Don't be aloof. Connect with church members, connect with family members, connect with everyone who's around you.
Yeah.
That in itself gives you, makes your your mind become well.
Yes.
The other thing is enjoy.
Yes.
This is where most of us go wrong.
Yes.
And some people will say, they are saying that because maybe they are born again, they are in church, they are in. But
Yeah.
we usually say, for you to have pleasure, it's not a must you take drugs. It's not a must you go doing things that are harmful.
Yes.
So look for an activity that can help you get pleasure without harming you.
Wow.
You can go to a swimming pool, to a big restaurant.
Yes.
Instead of taking alcohol, you are there swimming.
Okay.
You can go into a big restaurant.
Yes.
Instead of taking anything else, you are reading your novels at the end there.
Yes.
Okay?
Yes.
So the last step is stop, evaluate, start again. So after having learned all that, so from today, stop from what you've been doing. If you've been taking alcohol, stop that.
Yeah.
If you've been having like issues at workplace, stop and think. Then
Yeah.
evaluate,
Evaluate.
start again. So starting again means
Take care
taking
of your
an
people.
action,
Yeah. Okay.
and that will help.
Okay.
Yeah.
Wow.
I want to give a certain number because
Yes.
as in Mental Health Foundation, we partner with a certain rehabilitation center and a center whereby if you call, you can get help from
Yeah.
there.
Okay.
I want to share, if you allow me,
Go
share
ahead.
this number.
Go ahead.
If you call this number, it's for an unique called. We partner with a foundation known as Lifeway Mental Health Foundation.
Yeah.
This Lifeway Mental Health Foundation is a group of is a foundation that was started
Yeah.
with the name of doing research in mental health.
Yes.
But for us, so we
Yes.
usually because they have a center in Mental Health Foundation,
Yes.
we refer our clients. You can call this number. It's a 24 on number.
Yes.
When you call and you have depression,
Yes.
we will be able to sort it from that number.
Okay.
When you call, you feeling you can you want to commit suicide, we can be able to help you. It's a Lifeway. The name is Lifeway House Foundation.
Okay.
The number is 0746. For anyone who wants to get it, 0746 968 702. And I
All
repeat, 0746 968 702.
All right.
So when you call that number and you have a mental issue, we'll be able to help you in the shortest time possible. We can rehabilitate if it's drugs, we can treat, and we can do anything, intervention that requires mental intervention.
All right.
Yeah.
Thank you so much. That was very, very important to give a number where people can call. And thank you for finding time to come and share with us about mental illnesses. We are. You can be sure we'll have this conversation over and over until we achieve what we intend to achieve.
Yeah.
Yeah. So, my viewer, thank you for staying on board. I just want to appreciate someone that's written a very, very good comment. Joseph Mungara Chege. Thank you so much, Pastor, for this comment. He says, this is very important. There are many more others who cannot be classified as classical cases of mental patients, but continually struggle with fatigue, stress, anger, bitterness, etc., all of which affect our mental health. Often, we are too simplistic in explaining of their problems and prescribing remedies. There is need to create a safe place where people can be listened to, especially men. Keep up the good work. Thank you so much, sir. It's what you've said is very, very important, and we'll keep advancing these conversations until we see to it that people are living healthy lives mentally, socially, spiritually, and physically. We are very, very grateful for each one of you. Even Samis Nora, I saw your comment. Thank you so much for tuning in, and I appreciate that you coming out and explaining to us what PPD is. Thank you so much. And Liz Kariuki and Betty Maina and Matthew from Fortis Center and Cancer Center, thank you so much for tuning into this show. And just to ask you a question, do you have any concern concerning your mental health? Do you have a question you'd like to ask our panelists? They are ready to respond to your questions. They are very, very ready to respond to them. So just write that comment on our page, Convo with Dr. Fridah and James Wetu. You can also write your comment at Uzima Center page and Life of God broadcast. We will look at the questions and respond to them in this next session. So don't be shy. Put in your comments. If you have something you'd like to add about the discussion we've been having, if you have remarks you'd like to give, please put them down as a comment. We are ready to read. That is the next session we are getting into. Wow, I've learned a lot today, and I think I should write a book. You know, I write articles, but now I feel like I need to write a book about mental illnesses and mental health and where we are headed to as a nation, because I know these discussions are important. They are going to change the way we handle cases, mental health cases, even in church. When someone comes in and they are depressed, now we'll be more aware, we'll be more conscious that this person actually needs help and we can do something about it, instead of just folding our arms and, you know, thinking that there's nothing else to do for them. There's something we can do for every person that comes to us for help. So there is hope, there is help. If you're there and you're struggling with your mental health, if you're there and you have a mental illness, or you've just realized that, oh, the things they are talking about, I think I've been struggling with some of these things, please reach to us. We will connect you to these wonderful counseling psychologists and psychiatric nurses, psychiatrists. We will connect you to pastors that can pray for you as well. We will connect you to people that can really help you out of that place, because we said it's okay not to be okay, but it's not okay to stay that way. No one should stay depressed. I mean, it's okay, it's an illness, but you shouldn't stay like that, because as one of the people sharing a video said, that these mental illnesses affect your work performance and your social performance. So we need you to go back there to the society and be productive. That's why we are holding this conversation. So if you are struggling with your health, please, you can reach out to us in our inbox. You can call the number that Mr. Kariuki just gave us. You can talk to us on our pages and platforms, and we'll be very, very grateful. And I want to...
are watching The Convo with Dr. Fridah and James Wetu. Convo, encouraging conversation that matter.